Good morning, everyone, and thanks for being virtually here. In today's talk, I'm going to present a joint paper with Bruno Arpino, Valeria Bordone, and Aïda Solé-Auró about older people's non-physical contact and depression during the COVID lockdown. And this paper has been recently published in the Gerontologist. So starting with the outline of the presentation, I will briefly mention you the theoretical background, then I will introduce you the aim of the study, main research question, and then I will illustrate the original survey that has been collected during the lockdown, and then we will discuss together results and related conclusions. So starting with the background, one of the most evident and widespread consequences of the pandemic due to the lockdown restriction was the reduction in physical interpersonal contacts, which in turn may negatively affect mental health. And indeed, human relationships, both intergenerational and not, are fundamentally important for mental health, as they can act as a source of coping resources by dealing with stressful situation as it was the COVID-19 lockdown. Thus, limitation to physical interpersonal interaction may have subtracted irrelevant coping resources to individuals. However, social relationship at distance may have partially compensated the detrimental effects of physical distancing. For this reason, we actually aim to contribute to the evidence by examining whether older people that actually increase or maintain unchanged their non-physical contacts during the lockdown have suffered less in terms of perceived feeling of depression compared to their peers who decrease non-physical contacts. And to do that, we list some research questions aiming to understand whether mental health worsened during the pandemic, whether intergenerational non-physical contact increased during the pandemic, and how are changes in intergenerational and other type of interpersonal relationships were associated with mental health. In particular, we decided to focus on intergenerational relationships and other type of relationships among people aged 15 plus. To do that, we implemented an online panel survey based on quota sampling in Italy, Spain, and France between April 14 and 24. That has been specifically focused on intergenerational relationships and mental health measures. To address our main aim for this paper, we used a logistic regression defining the main outcome has in terms of probability to experience a worsened mental health, and our main independent variable was changes in non-physical contacts, both intergenerational and other type of contacts. And of course, in our model, we included a set of covariates, socio-demographic and economic variables, and we also include changes in physical contacts. We use also post-stratification weights based on official statistics with the aim to minimize deviations from the benchmark population. And we also specifically look at heterogeneity in findings by living arrangement, age, gender, and country. So as you can see from these descriptive statistics, a large part of the population in Italy, Spain, and France suffer for depression, for an increase in depressive symptoms during the lockdown. And this has been mostly reported by females living in Spain. So looking at main results, we basically found that those who increased or unchanged their non-physical contacts, both intergenerational and not, were significantly less likely to experience worsened mental health during the lockdown. And this finding was mostly reported by those who were living with at least one co-residence, while having unchanged frequency of intergenerational contact was slightly more relevant and important for people living alone. At the same time was really interesting because we didn't find gender differences in the effect that frequency of non-physical contact had on perceived feeling of depression. However, we found a stronger benefit of increased and unchanged intergenerational non-physical contacts for the oldest individuals belonging to the age group 70 plus and for those living in Spain. To conclude, I will say that intergenerational and other non-physical contexts have been important for buffering the mental health consequences of the pandemic, and that worsened mental health during the COVID-19 pandemic is a serious issue that needs more attention and should be addressed also in the longer run. Just as a side note, given the importance of non-physical interactions among humans, we suggest to avoid using the term of social distancing and use indeed physical distancing, since physical distance guidelines and policies need to be supported by measures for fostering social connectivity. So thank you very much for your attention.